This special topic presentation for EDS 8830 is on mindfulness, meditation, and breathing techniques for emotional regulation and attention. For Piedmont College by James McMicken. So before we begin, I just have a few questions. Currently, what's on your mind? What's around you? How do you feel? And how are you breathing? So how did you respond to those questions? Were you thinking about plans for the weekend, deadlines or projects that need to be completed? Or maybe you were thinking about an argument or disagreement that you had with a coworker or significant other. And what's going on around you? Are your kids about to launch into World War III in your living room and you're just hoping to avoid a trip to the ER? And what about the ever-present screens that are in our lives? Are you thinking about a show you'd rather be binge-watching right now, or hoping that your significant other isn't doing that without you? And what about the biggest attention vampire of them all, the cell phone? With social media, all the possible arguments that you could have on there, all the things to captivate your attention and pull you away from the things that you really need to do. So the question is, are you really present in this moment? So with that in mind, I give you this quote by William James. The faculty of voluntarily bringing back a wandering attention over and over again is the very root of judgment, character, and will. No one is a master of themselves if he have it not. An education which should improve this faculty would be the education par excellence. So with that in mind, this presentation is for any person who would pursue improving this faculty and achieving the ideal of the education par excellence. So how can we begin to attempt to do this? We can introduce the concept of mindfulness. And mindfulness is a strategy of intentionally directing attention to the present moment experiences. We do this with curiosity, acceptance, and non-judgment. So curiosity comes into play when we are distracted and we curiously examine the things that are taking our attention. We accept those distractions for what they are. Negative thoughts are simply negative thoughts. They're not facts. And so this comes with the non-judgment aspect of mindfulness as well. Mindfulness has its roots in Buddhist meditation traditions. However, it is a widely practiced secular strategy for building attention. It has been used as an intervention in many different arenas. And these forms of intervention or mindfulness-based stress reduction, which was developed for patients who are coping with illness, pain, and stress, as well as mindfulness-based cognitive therapy, which was developed to prevent resurgence of depression. So now we move on to the concept of breathing. The breath knows how to go deeper than the mind. Wim Hof, extreme athlete. And I've got to keep breathing. It'll be my worst business mistake if I don't. Steve Martin, actor, comedian. So when we talk about breathing, it seems like a very simple endeavor. However, when we practice mindfulness, we notice that our breathing is not always as beneficial or as healthy as it should be. Mindfulness practices such as martial arts, yoga, meditative traditions have all practiced breathing in some way. And today, contemporary examples would also be athletes and Navy SEALs. So is there a correct way to breathe? So the biggest question we should ask is, should we breathe through our nose or our mouth? There's an old proverb that says the nose is for breathing, the mouth is for eating. And if we just look at the design of the nose compared to the mouth, the nose has many natural features used for filtration, such as nose hairs, cilia, and mucus, which is designed to trap dust and bacteria from entering the respiratory system. The mouth does not have many of these same functions, and therefore many infections and subsequent diseases are evident in mouth-breathing individuals. So we also see that nitric oxide production also increases when individuals engage in nasal breathing. And this production of nitric oxide, as well as the other effects of breathing, show that this is an integrated system and that the breathing respiratory system can impact the parasympathetic and parasympathetic nervous systems, as well as the brain. So individuals who breathe through the mouth typically have lower levels of oxygen in the brain, as shown by EEG scans performed by Hong et al. These insufficiencies in oxygen to the brain have resulted in lower reading ability, working memory performance while performing arithmetic procedures, as well as effects on sleep. Nitric oxide is also produced, more so when individuals breathe through their nose. And this has been shown to increase brain activity, stimulating capillary-like tube formations in hypoxic areas in not only muscle but also brain tissue, and is also a precursor for stimulating neurogenesis and long-term potentiation. So how does this apply to student learning? Well, mindfulness is useful in that it can improve attention, self-regulation, reduced anxiety, and emotional regulation. So the process of redirecting one's attention back to the task at hand over and over again requires effortful control, as noted by Ormrod. The other aspects of self-regulated learning that she mentions are attention control and self-monitoring, and mindfulness includes all of these aspects in the practice. Emotional regulation is the intentional effort to reduce or change one's emotional state, and this is also supported by the research. Shahidi et al. Found that mindful-based stress reduction could reduce test anxiety in students and increased emotional regulation, as we know that heightened arousal states lead to diminished learning, as noted by Ormrod. Furthermore, breathing has also been shown to reduce anxiety, improve positive thought, improve cognition function, and self-regulation. The idea of reducing anxiety is also similar in mindfulness. However, this idea of improved positive thought is unique in that other forms of therapy, which include just changing negative thoughts into positive thoughts, is a little different in that when we apply mindfulness and breathing, students tend to automatically generate more positive thoughts, and so they're not having to redefine negative thoughts into positive thoughts. We're overall creating more positive affect in our students. Gupta et al. And Hong et al. Also found that students who practiced deep breathing exercises improved their cognition in the forms of being able to have greater working memory and heightened literacy. And again, self-regulation, the idea that we can control our actions, is also a benefit when it comes to controlling your own breathing. So these implications for teacher instruction. Well, if we implement these things, we're teaching the whole student. We're addressing the hierarchy of needs in that we approach the lower levels of safety and esteem needs first before we move on to the higher levels. And practicing emotional regulation and attention and self-regulation are all soft skills that students will need to improve their academic, personal, and professional lives. We have a window of opportunity, which is from the age of 14 and 18 years of age, which includes heightened brain plasticity, increased self-reflection, social perspective taking, more interest in understanding self and others. And this means that high schoolers are particularly keen at improving themselves through mindfulness. But also we have increasing mental health problems with our youth. We have more intense stressors, depression, and anxiety disorders, which we did not see in the past. And so by implementing these interventions, we are helping our students holistically. You can use various curriculums to implement mindfulness in your schools, such as learning to breathe. This could also just be a class warm-up activity in which students perform these tasks before engaging in the work of the day, or they can be used as coping methods to help students relax during times of anxiety, such as taking a test. As far as cost and time, you can buy a curriculum, but also you can simply implement these things, these strategies, very effectively with little cost or time input. It doesn't take a lot, but we've seen a lot of growth in our students when these practices are implemented. So I'll leave you with this quote: "School systems are not responsible for meeting every need of their students, but when the need directly affects learning, the school must meet the challenge." By the Carnegie Task Force on Education. In this last quote, "I learned that I can control the way I react to things and that nothing is too overwhelming for me to handle." And this was a student who actually engaged in the Learning to Breathe curriculum created by Broderick. And these are some resources that you can use if you'd like to further your learning in these areas of mindfulness and breathing. And these are the references.